39-year-old Winnie Fernandes visits the Karolinska hospital in Stockholm once a month now. Last year, she was often being admitted to the emergency room with symptoms that doctors couldn't diagnose. It all started with abdominal pain. After a series of medical tests, it was suspected that cancer was spreading from her ovaries, so she was immediately scheduled for surgery.
Undergoing surgery, I was going with the knowledge that if there was cancer, if they could find cancer in any part of the body, at the abdominal cavity or the genital cavity, pelvic cavity, then they would operate and remove the affected organs. And if it wasn't, then we could further investigate what it is that's causing the inflammation and the fluid collection in the body.
The mother of two was surprised to hear that the doctors had found unexpected bacteria in her abdomen.
So when I opened my eyes after surgery, I was told that I don't have cancer, and that caused, if I could physically, I would have been jumping on the bed, but I wasn't in that state. I was happy to know that it's not cancer and that it's tuberculosis. So I felt, yeah, this is something I can, and I think it's a much better diagnosis than what I was told.
The most common form of tuberculosis affects the lungs, and here you see typical changes at the upper part of the right lung. But tuberculosis can also affect other parts of the body, such as the abdomen in Winnie's case. Other parts of the body that are commonly affected are, for example, lymph nodes on the neck or the skeleton.
People are traveling the world more extensively than ever before, but unfortunately, bacteria also travel with them, making the disease a global problem. Despite significant progress in reducing the number of cases in Europe, tuberculosis, TB, is still a problem in some countries and in large cities. Even though the numbers are lower for the lesser-known extrapulmonary TB, the form of the disease is not that rare. Marieke van der Werf from the European Agency dealing with infectious diseases explains.
For years, the number of TB patients in the European Union has been decreasing. But in 2011, we still had 72,000 TB patients, and 1 in 5 had extrapulmonary TB.
In low-incidence countries represented by less than 20 TB cases per 100,000 population, extrapulmonary cases can be even more difficult to diagnose.
And if we look at the surveillance data that we have at ECDC, then you see that extrapulmonary TB is especially prevalent in countries with a low incidence of tuberculosis.
One Italian patient who prefers to remain anonymous recalls seeing her family doctor about a minor swelling in the chest. After visits to a physiotherapist, an orthopedist and a rheumatologist, she was finally hospitalized for a full clinical investigation.
Appena entrata ho fatto subito una PET.
The first thing they did was a PET scan, then a CAT scan with contrast agent, then an ultrasound scan, and finally a needle biopsy. This time, though, they did an in-depth histological investigation. Unlike the previous time, they also did a microbiological culture.
In this case, culturing the bacteria was essential to obtain the final diagnosis. Although reliable, the method can take up to 6 weeks. And while with pulmonary TB the sample is easily collected from the lungs, with extrapulmonary TB the process can be extremely difficult, depending on where the bacteria are located in the body. After confirmation from the lab in Brescia's main hospital, the patient was told she had extrapulmonary TB.
It came as a shock, because it's definitely not the sort of thing you expect, a disease like that. Firstly, because I thought that tuberculosis only affected the lungs, not other parts of the body. I'd never heard of such a thing.
Late diagnosis is one of the most common problems for extrapulmonary TB patients. It requires thorough investigation to be found, and the bacterium is easy to miss if doctors aren't specifically looking for it.
One of the basic reasons why the disease was not recognised in 2009 was the failure right at the beginning to consider the possibility of tuberculosis. This is easy to understand in a country like Italy, with a low incidence of the disease and where cases are very rare. In a small town like the one the patient comes from, cases of tuberculosis are almost unheard of. Also, when you're dealing with non-pulmonary tuberculosis, rather than the pulmonary variety, it is even more difficult to make a connection between the symptoms and the disease.
The problem in Sweden is that tuberculosis is so unusual today, with about 600 cases per year. However, tuberculosis is common in countries where our patients normally come from. It is a common disease. The problem when seeking treatment in Sweden with typical tuberculosis symptoms is that tuberculosis is not considered and other diagnoses are preferred.
Like Winnie, around 25% of TB patients in the European Union are foreign-born cases. The proportion varies significantly across European countries. Nevertheless, getting a confirmed diagnosis is only the beginning. The treatment for tuberculosis normally lasts for 6 to 9 months, and it is not always well tolerated.
After about 3 months of taking medications, I developed complications with which was basically abscesses in the abdominal cavity. In order to treat those, I had to then take more medications that in the form of pills as well as injections every alternate day.
Complications and treatment failures are not that uncommon. Only 74% of all TB patients in the EU successfully finish the treatment. To help them through the process, patients need direct supervision from medical staff. A trained nurse herself, Winnie often relied on the hospital nurse to help her manage up to 200 pills, which she had to take every month during the full course of the treatment. It'll take some time until more effective drugs and vaccines are available. Meanwhile, this is still the reality for many TB patients on the road to recovery.
Extrapulmonary TB is often overlooked in TB control strategies because extrapulmonary TB patients are not infectious and do therefore not transmit the disease. But if we look at the surveillance data that we have at ECDC, then we see that extrapulmonary TB is not decreasing, whereas pulmonary TB is decreasing.
I think we need to act on 2 fronts. We need to raise public awareness of the disease. At the same time, we need to increase and maintain awareness of the disease among healthcare practitioners, though this is complicated by the fact that tuberculosis is in steady decline.
What I know is a problem for many patients, and also for this patient, is that even if tuberculosis is well known, as it was for this patient, it is a hard diagnosis to receive, and the treatment is long and arduous for the patient, who requires lots of support from the healthcare for the patient to follow through, and for us to be able to help the patient with the anxiety that this condition brings.
For both patients, the treatment has been successful, and the long story of extrapulmonary tuberculosis has come to a happy ending. However, the physical and psychological marks will remain. For some, tuberculosis still brings the fear of stigma, and it is difficult to talk about.
So I've always thought that if people found out about it, they might start saying, "That person is sick, she must be infectious, she should be isolated," and so on. So I have always avoided it. Maybe I decided not to tell anyone because I have never been able to accept it myself. If I had accepted it, it would not have mattered to me if others knew about it.
It emotionally took a toll on me as well as on my family because the kids were affected, my husband was affected, my parents and parents-in-law in India were affected. So there's the whole community that gets affected, and it's tough. It was quite tough.